So 8 weeks of pregnancy, I went for my first ultrasound. Doctor comes in, he lets us know, hey, it's twins. It's going to be a little bit different. There's going to be a lot of blood drawn. You're going to have a lot of appointments.
My name is Rodrigo Ruano. I'm a maternal-fetal medicine doctor, high-risk pregnancies, and also a fetal surgeon. The most procedure that I'm known of is tracheal occlusion. When we place a tiny balloon inside the trachea of the fetus, tracheal occlusion for congenital diaphragmatic hernia. Second procedure is I can put a tiny telescope inside the baby's bladder, so we call fetal cystoscopy for bladder outlet obstruction. Third is that from twin to twin transfusion syndrome, I can put a tiny telescope inside the fluid and we can separate the connections in the placenta. And the fourth condition that I treat spina bifida or myelomeniingocele.
The ultrasound tech starts and she realizes that one of the babies, the way it looks, it's like two little round sacs with black around the babies. And then when the fluid leaves, there's less black around the baby. So this one had no black around the babies. The surgery is the one thing that can help. There's nothing we can do. The babies are in there, they're breathing, they have heart rates, everything is good. We just need to get to the surgery.
Pregnancy was complicated with a twin-to-twin transfusion syndrome, which is when we have connections between the placenta and those connections are not balanced, and the amount of fluid was increased, so she was distended.
Dr. Ruano, from day one, since I sat with him, he just made me feel so comfortable. He made us both feel like, this is a possibility, we are going to get through this. And they're just doing really, really well, better than I could have imagined. I would love to thank Dr. Ruano and his team, both places, at his office and, actually at Jackson. They're just amazing. There's nothing that I could have asked more of anybody. Everybody knows what they're doing and you don't have to worry about it. It's not like, are they in the best possible hands? They are in the best possible hands,
So we fight for those babies, we fight for those pregnancies, and we fight for those mothers. So that's the benefit of having a fetal surgery program.